We are going to be reviewing this morning the Medicare coverage of opioid use screening and treatment and some of the programs that Medicare has involved with both of those topics. My name is Rachel Wood, and I'm a nurse analyst with the Provider Outreach and Education team. I'm joined by my coworkers and the fellow nurse analysts in Provider Outreach. Mary Sue and Jennifer are going to be monitoring and helping with our chat and any questions as they come through. So if you do have any questions as I'm going through our slides, please send those in to all panelists in our chat feature. And we are going to be, as we go through some of the information, answering some of the pre-submitted questions that we received beforehand today as well. Regarding materials, those are available on our live events page. And we did just post the copy of our slides that I'll be talking through this morning. All right, so here's our disclaimer. Really quick with this, basically what our disclaimer says is that our education is for informational purposes only. Medicare does change their rules and regulations from time to time, so please make sure you look at any updates from Medicare and those CMS communications for the most up-to-date rules and regulations. That does take precedent over anything that we go over this morning. Additionally, we are recording this ourselves, so please no recording this yourself. We will be posting this presentation on our YouTube channel as an encore, so if you want to go back and take a look at anything or show any of your coworkers, that will be out there in a few days for you guys to take a look at. All right, some acronyms that will be used throughout our slides. These are just as a reference for you all. This topic has a couple of unique ones to opioid use, so the OUD and OTP, as well as the substance use disorder. Some of the key ones that I'll go through in our slide are listed here, just again as a resource for you all if you want to look back and just double check what anything means. Okay, so here's our agenda and our plan for our presentation today. I'm going to start by talking about the behavioral health initiative services and some of the things that Medicare has going on with their mental health or with mental health and some of the coverage initiatives that they are putting into place. Then I'll talk a little bit more in depth about the coverage of opioid use disorder screening and treatment, and then follow up with some good resources and any questions as they come in. If we don't get to your question today, or say it's billing specific and we want to just check, we will send out any outstanding questions via email. So please just keep that in mind, as we go through our information this morning. All righty, so let's start by talking about the goal of Medicare's updates to behavioral health coverage. So first and foremost, Medicare's goals with their behavioral health services is to ensure that they're providing high quality behavioral health services and support that are accessible to Medicare beneficiaries. Additionally, they are looking to provide access for Medicare beneficiaries with behavioral health needs with person-centered, timely, and affordable care, that enables optimal health as well as wellness. Prior to working with WPS, I did work as a mental health nurse in an inpatient unit and have seen firsthand just how impactful mental health care can be to, patients in not only with their, mental, state, but also their physical well-being. So mental health is really, a big impact and a good thing to be focusing on. So Medicare is focused on the needs of people of all ages that they serve in every stage of life. So those that are at risk or have substance use disorders, people with chronic or acute pain issues, as well as those that face different various mental health challenges. There is, within the Medicare 12 cross-cutting initiatives as part of their current strategy, a big section that talks about behavioral health. The behavioral health cross-cutting initiative investments and outcomes fact sheet. We do have a link that I believe we can put into our chat if you would like to take a look at that. Some of the areas covered within that initiative include behavioral health integration, including a collaborative care model, psychosocial therapy for crisis, and then opioid use disorder screening and treatment. So that's why we'll be talking about that a little bit more in depth today. All right, some of the key areas of focus for Medicare's behavioral health priorities include advancing the Health and Human Services Roadmap for Behavioral Health Integration, advancing the Health and Human Services Overdose Prevention Strategy, and then finally the Pain Management Task Force Report. So some of the focuses on these priorities and these areas include some key elements that are listed on our slide here. So first is substance use disorder prevention, treatment, and recovery services. Next, ensuring effective pain treatment and management. And then finally, improving mental health care and services. Some of the key focuses there. Key health outcomes. So these key areas of focus are aligned with Medicare's overall focus on 4 health outcomes based on the domains that are listed on our slide here. So these include coverage and access to care, quality of care, equity and engagement, as well as data and analytics. So these are kind of broad spectrum terms, and I do want to expand a little bit on what they mean by each one, as just take a minute on our slide here to do that. So first, coverage and access to care. So focusing on behavioral health, Medicare is looking with their initiatives and some of their programs to improve the care experience and increase strategic opportunities that enhance high quality, equitable, and affordable whole person-centered care. Additionally, they're looking to expand the workforce capability and within multiple settings. So that includes primary care as well as specialty residents to help earlier detection, diagnosis, as well as management of behavioral health issues. With coverage and access, they're also looking to strengthen access to treatment and recovery services and ensure effective evidence-based pain treatment and management for individualized care. Moving to quality of care, focusing on quality of care of behavioral health for Medicare beneficiaries. One of the things Medicare is looking to do with this is improve their quality measurements by better understanding and improving measures in behavioral health, substance use disorders, as well as pain management. Increase the opportunities to enhance access to, again, that high quality, affordable care. And then finally, with quality of care, expand access to community-based mental health services and resources that support care management, crisis prevention, and recovery. So next we have equity and engagement. This is a big thing in a lot of Medicare's programs, but specifically for behavioral health, looking to increase equity and engagement by reducing disparities that improve overall access, providing effective outreach and education. That's kind of where we come in as the MAC to inform beneficiaries, consumers, as well as providers, what's out there as far as materials and programs. And then finally, identify and address any barriers that, are in the way of access to evidence-based treatments and anything to manage those behavioral health issues. And then finally, data and analytics. This one's pretty straightforward, but looking to help advance behavioral health services by supporting data collection and collaboration through partnerships across the government, using the Medicare behavioral health strategy to drive program improvements, and then finally creating and integrating data sources to better improve the knowledge about behavioral health in Medicare programs. So data-driven, care is very important to the success of this, some of these things that they're putting into place. All right, so a little background before I get into the screening and treatment coverage on recent mental health initiatives. So on November 6th, 2023, Medicare released change request 13389, and that became effective. So this, for those that are not familiar, a change request is a communication that is released from Medicare. And in this transmittal, Medicare instructed all of the MACs to send out a letter to any eligible physicians and non-physician practitioners about Medicare-covered behavioral health service updates. So some of those things that were included and outlined in that letter include some of the things I've mentioned today already, so behavioral health integration with that collaborative care model, psychotherapy for crisis, and then finally the opioid use screening and treatment. So based on some of those initiatives and information in that provider letter, that is why we are providing some additional education on these areas. We did hold a webinar back in December on just an overview of what was in this letter, and I believe do have some upcoming education planned for the first two bullets on our slide here. And then obviously we're talking a little bit more about opioid use screening and treatment today. So just some background, to give you kind of the why we are holding this webinar this morning. All right, so I'm going to start by talking about Medicare coverage for screening and treatment in the next few slides. So first I'm going to start with screening patients for opioid use. So Medicare will pay for opioid use disorder screenings that are performed by physicians, non-physician practitioners, and this is something we wanted to highlight. This was a pre-submitted question by a couple of our attendees. Additionally, Medicare will also pay for treatment services that for those diagnosed with opioid use disorder. We're going to talk a little bit more about those treatment services after we get through our screening services, though, in the next couple slides. All right, so again, screening is something that Medicare covers for patients with opioid use disorders and can be done in a couple of the following areas. So first that I want to talk about is that this is a part, screening for opioid use disorder is a part of the IPPE. So this is a required screening element of this visit. During the IPPE, providers are required to review any current, if any, opioid prescriptions, review with the patient any potential opioid use disorder risk factors. For more information on that, that is outlined in the Medicare Learning Network's article on Medicare wellness visits for more specific info. Additionally, evaluate for pain severity and current treatment plans that the person might already be on. And then finally, provide some information about opioid treatment options. So that's all included in some information you should go through in the IPPE. Next, it is a required screening element as well for the advanced wellness visit, so the AWV, and some of the areas in the AWV that we would be screening would include, during your health risk assessment and any additional components, looking for any of those substance use issues or opioid use disorder possibilities, or if it already exists, and then providing referrals for patients for treatment as appropriate. And then finally, during visits in physician offices as well as outpatient hospital settings. So in these cases, you can offer what's called screening, brief intervention, and referral to treatment, or expert treatment services. And I'm going to talk a little bit more about that in the next couple of slides. All right, so talking about screening, brief intervention, and referral to treatment or expert services. So, what is this, and, what kind of entails this approach? So expert entails the following. It's an evidence-based early intervention approach. The aim for people is for people with non-dependent substance use prior to needing that extensive or specialized treatment. So you're getting them early before, it's kind of a full-blown, deep-seated issue that's a lot more difficult to overcome. Effort may be used in the office or outpatient settings and during those visits to screen those that are not actively seeking substance use help. So it doesn't only have to refer to those that are, currently looking for treatment. It can be done across the board. So in the primary care settings, providers may systematically screen people who may not seek substance use help and offer these escort treatment services to allow for a couple of the following things: reduce potential healthcare costs by catching, again, those problems early, decrease drug and alcohol use severity if it does exist, reduce the risk of any physical trauma, so again, catching these problems early and hopefully mitigating them before they get, before the person needs extensive intervention. And then finally, reduce the percentage of patients that are going without any specialized treatment that might actually need it. So during, again, these physician office and outpatient visits, Medicare will pay for these escort treatment services. It does depend on the duration. So if you're billing, some of the billing information is included in, I believe, the MLN. But for example, if it's a 5 to 14-minute screening, the G2011 code applies. 15 to 30, G0396, and then 30 minutes or greater for this screening would be the G0397. And additionally, this is something that is under a preventative service. So talking a little bit more about some of the components of this. That starts with the screening. So providers will screen and assess a patient that, might have, or patients for risky substance use behaviors using standardized assessment tools to help identify what appropriate level of care might be applicable to that patient. So screening quickly assesses a patient's substance use severity, as well as identifies, again, that appropriate level of treatment that they might need next. So next on our slide here is brief intervention, and this is the next component. So brief interventions increases substance use insight and awareness, as well as starting to help with that motivation for behavioral change. So in this step, in this component, it involves engaging the patient in maybe a short conversation to increase their awareness of any risky substance use behaviors, and allows the provider to provide feedback, motivation, as well as advice. That's one of the things that is pretty important is, kind of getting that conversation started. Next will be a referral to treatment. And this is the final component of the expert, process that I want to touch on. And this is, as it sounds. So you're referring the patient to the appropriate therapy or specialty care based on the assessments and screening that, you just conducted. All right, so who can apply and who can provide this service to Medicare beneficiaries? So on our slide here, we did list the eligible providers. So physician assistant, physician assistant, nurse practitioner, clinical nurse specialist, clinical psychologist, clinical social worker, nurse midwife, and then independently practicing psychologists are the providers that Medicare lists that are able to perform this service. All right, so that was some information on the screening options. Now I want to talk about some of the treatment options for opioid use disorder. So what if a provider diagnoses a patient with the opioid use disorder? What are some of your treatment options? So we have these listed on our slide here. Medicare will pay for certain treatment services. So first would be evaluation and management visits for medication management. A little background on what evaluation and management or E&M visits include. So these are CPT codes 99202 to 99499 that represent visits and services involving the evaluation and management of a person's health. So with the context of opioid use disorders, you can use E&M visits to provide medication management to make sure the patients are taking their medications properly as part of the recovery process. Medications prescribed for patients, it could include maybe buprenorphine or naltrexone as two examples. Next, treatment service would be office-based substance use disorder treatment services. And these are a way for you to bill for a group service in the office setting. Medicare does cover a monthly bundle of services for those patients that are prescribed buprenorphine or naltrexone in the office setting. More information and billing info can be found on the Medicare website that details this treatment service. And so that is our second option. And then our third is opioid treatment programs, so OTPs, and these are a more comprehensive treatment method. So OTPs, and just a little bit of background, and we will talk more about them in our next few slides, but these provide medications for opioid use disorder. So for example, methadone, buprenorphine, and naltrexone for patients that are diagnosed with opioid use disorders. These must be accredited by the Substance Abuse and Mental Health Services Administration that are certified and accredited and approved by an accrediting body. So a little bit more intensive treatment, and they do have a little bit more details and rules related to what those services look like. All right. So office-based substance use disorder treatment services, we did just briefly mention this as one of our second option on our slide here. Again, Medicare will cover a monthly bundle of services for patients that are prescribed certain medications in the office setting to treat substance use or opioid use disorder. So some of these bundles include overall management, care coordination, individual and group psychotherapy, and substance use counseling. All righty. So that brings us to opioid treatment programs. And so far, we have covered a lot of information. We've talked about some of those main components of the Medicare Behavioral Health Initiative, some of the screening options, as well as some of the treatment options that Medicare will cover for substance use and opioid use disorders. So I want to talk a little bit more here about the opioid treatment programs in the next couple of slides. As a kind of precursor, I'm going to be just touching on some of the information, but we do plan to hold a more in-depth webinar on just opioid treatment programs at the end of March. So if you have a lot, if this is something you deal with, please, consider signing up for that, which I believe is already out there on our website as being advertised. So as I said, these OTPs, they provide medications for opioid use disorder. So for example, the methadone, buprenorphine, and naltrexone, and they must be certified by the Substance Abuse and Mental Health Service Administration. So that is kind of a precursor and the most important thing for the OTP programs. Part B will pay for medications for opioid use disorders that are provided by an OTP. There is no co-payment for OTP services for Medicare patients, but the Part B deductibles do apply. So something to, just know, maybe pass on to your patients. And additionally, patients with Part B and an opioid use disorder diagnosis are eligible to get treatment services at an OTP. So some of these, and we'll go through that in a little bit more detail, but some of the options include providing Medicare-assisted or medication-assisted treatment for those Medicare beneficiaries. Additionally, another criteria that I just want to highlight must be accredited by the Substance Abuse and Mental Health Services Administration, and the OTP must be enrolled with Medicare. We do have a link here on our slide for a list of Medicare enrolled OTPs if you're interested on taking a look at who is already enrolled with Medicare, and that list is out there for you. All right, so some info on the OTP coverage. So as I said, again, they provide medication-assisted treatments for those diagnosed with opioid use disorder. So some of the things that are covered within the OTPs include what is listed on our slide here. The drug administration of opioid or of approved opioid agonists and antagonists, dispensing and administering those medications, substance use counseling, individual and group therapy, toxicology testing, intake activities, periodic assessments, and intensive outpatient program services. So we do have, I believe, a link to, if we don't have an ML link, we can send it out if people are interested. But there are, we have actually in the next few slides, I have the IOM information. So just moving forward with that. But another thing with OTP coverage that we wanted to mention here is that they can provide substance use counseling and individual and group therapy services through two-way audio video interaction. So that is another option to provide some services to your beneficiaries. All right, so a little bit here on the OTP enrollment. And this was based off of one of our pre-submitted questions, which was what type of credentialed clinician can perform this service, and do they need to be enrolled through PICOS? So again, Medicare Part B covers OTP services with enrolled freestanding OTP facilities and hospital outpatient departments. So as an OTP, providers or these facilities will enroll as a Part A or Part B provider for this Part B benefit. And again, you do have to be fully certified by the Substance Abuse and Mental Health Services Administration to be able to enroll as an OTP and bill for Medicare services. So for those institutional providers, enrollment options include enrolling either using PICOS. You can enroll using the CMS 855A form, or submit your claims electronically, and you'll submit your claims electronically using the 837 institutional or paper claim CMS form 1450. So prefacing here, not an enrollment specialist. If you do have any provider enrollment specific questions, we can take that back. We did just want to provide this information. And then regarding professional providers, the options to enroll in Medicare include PICOS or using the CMS 855B form. And this is this will be for claims that are submitted using the 837P or paper claim form CMS 1500. We do have a link that we did put into our chat that just gives some highlights on Medicare provider enrollment. So take a look at that. It is just the basics for Medicare provider enrollment, but we wanted to provide that info to you all. All right, so next two slides, I believe, just has a couple highlights on some of the OTP billing information. Want to preface again that any questions we can't answer regarding billing, we will take back, and we will also be doing a more in-depth presentation on this treatment program at the end of March. So first and foremost, claims for OTP services should be using place of service code 58. And that's not on our slide here. I just wanted to mention that. In recognition that there is a range of service intensities that depend on the severity of a patient's opioid use disorder, as well as the stage of treatment, a full weekly bundle may consist of very different frequencies of services for a patient that is maybe in that initial phase of treatment compared to those patients that are more in a maintenance phase of treatment or other factors, that might specifically individually affect that person. So that's one of the things we also wanted to mention. It's not included on our slide here as well. But some of the highlights that we wanted to go through. So first, providers should provide at least one service, so either a drug or non-drug component to the patient during the week that corresponds with the episode of care. So if no drug is provided to that patient during that episode of care, providers are able to bill with the G code describing a weekly bundle without the drug. So for example, code G2074. With this, bill at least one service in the non-drug component. And so if you are providing a drug with or without additional non-drug components, again, billing that appropriate G code describing the weekly bundle, including the drug, applies. More information on the specific codes for OTP for OTPs can be found in the Internet-only manual, section 100-02, Medicare Benefit Policy Manual, Chapter 17, as well as some more information regarding add-on codes. This can be found in publication 100-04, Medicare Claims Processing Manual, Chapter 39, Opioid Treatment Programs. So there is a lot of different codes included in that second resource. Please take a look at that and use that as a reference if you are having any specific questions on any of these codes. All right, just a little bit more information here on our slide. So first, for G2078, this applies to a take-home supply of methadone, and G2079, this applies to the oral supply of buprenorphine. The data service for these on the claims should reflect the actual date that the medication is provided or the first day in a weekly billing cycle for that week that the patient gets that take-home supply. Some common questions that we've seen with these codes, so we just wanted to mention that here. And then the second thing is for G2216, so this is a take-home supply of injectable naloxone. Use this code, when you use this code, round to the nearest whole number. So just another, kind of tidbit for billing on this one. All right, so that brings us to our resource section on some of the key things. We did put some good links in our chat, and then if you do have any more interest, we have the link to the claims processing manual that has some of those add-on G codes here, the Medicare Behavioral Health Strategy website, as well as some more info specifically on opioid treatment programs on our resource slide here. All right, and so before we open it up to the chat for questions, there are two pre-submitted questions that I wanted to touch on. So first is, does Medicare cover telecommunication for OTPs? So I did already briefly mention this, but just to reiterate that per the Internet-only manual 100-02, Chapter 17, starting January 1st of 2023, OTPs are allowed to furnish OTP intake with two-way audio video communication technology to start that treatment with some of these medications, as well as using this for group therapy. So one thing with the telecommunications that I do want to highlight is that during the public health emergency, Medicare did state that there is the ability to do audio only, and this is going to be something that's phased out at the end of calendar year 2024. So just keep that in mind, that if, that's something you're using, pay attention and, watch for those updates. But the two-way audio video communication is something that Medicare does allow. All right, and then the next question is Narcan covered as a take-home medication for Medicare population? So Narcan is also referred to as naltrexone, is furnished as a take-home supply. So if the OTP does furnish a take-home supply of a medication like this, approved for use to treat opioid overdose, then the bundled payment rates will be made when the medications are dispensed. So short-term answer is yes, that it is something that would be covered, and the opioid treatment program should document in the medical record just, why the person needed to take this medication home and what's the medical reasonable and necessary rationale. All right, so with that, we have a few minutes left. Are there any questions that have come into the chat? Let's see here. Looks like, wonder if I've accidentally muted my co-host, but I can scroll up and see. Let's see.
I'm sorry, Rachel. Can you hear me now?
Oh, yes.
All right, perfect. Yes, somehow I got double muted. Okay, so the first one I think you already answered, but I'm just going to review it again because she did say thank you when you went through this. But what is required for the opioid use screening, and is there one that we recommend for use for this? And it goes on to additionally ask, is screening only required if the patient has a current prescription for an opioid?
Yeah, so that's a great question. And Medicare does not, as far as screening tools, there is not one that they specify providers must use. Typically, the tools that, and for most other cases, so for pain management and, some of these other scales, they need to be approved, and standard use in, healthcare practices. But there's not one specific screening tool. Some of the mental health societies have some good tools on their website, and I apologize because I'm blanking on what that's called, the mental health, what is it? But they have some good tools on their website. But no, there's not one specific tool. And also the second part of that question, is screening only required if a person has a current prescription? No, so that kind of goes to that expert thing, expert approach we were talking about. You can screen patients if they present with any possible risk factors or, just as a preventative measure, because, sometimes people present in various ways and may not show the standard signs, but you ask them some questions and you find out more than you thought you would. So it's current prescription of opioids is not a requirement to screen for opioid use disorder.
Perfect. And then the next question, and I had put a link in the chat for everyone, and the question was, are there any restrictions on specialty of provider who can do the SBIRT? So I just want to let everyone know that I did attach a link into the chat for the SBIRT fact sheet, and it has, you know, a whole plethora of providers that are Medicare eligible providers that can perform this service. So that's kind of why that was put into the chat. So I do encourage everyone to go out and take a look at that. And I think that is the end of our questions.
Well, awesome. Yeah. And yeah, I thank you for putting that link in. Any specific provider info will be included in that. But there's not any specialty restrictions beyond what I listed on our slide that I'm aware of. So with that, I also do not see anything else. That wraps up our presentation today. So on behalf of myself, Provider Outreach, and Mary Sue and Jennifer, we want to thank you for staying with us and, you know, asking your questions, participating in our event. So we look forward to reading those survey comments and having you join us for future WPS webinars. So have a great rest of your day, and you may now disconnect.